studio.
Yeah.
Okay, so
That's scary.
we're basically we work with women mostly who are in an age group, between what 40, 60s,
Yeah.
stuff like that.
Yeah.
And so bone density is a really, really big issue. And if it's not an issue yet, it's something that we should all be thinking about because, 10, 15, 20 years down the road, it might be an issue,
Yeah.
right? And so what we do today is going to be really important in the future of laying down that foundation of strong, healthy bones. So, before, I took about 2 pages of notes, and I don't want this to be boring. So I'm going to, let's just like kind of start with talking about what we've seen in real life. What have we seen with bone density?
Yeah. I mean, women are always they're just shocked that they have thinning bones when I call them with their results and I tell them that they're osteopenic and they want to know what that word means.
Right.
So I guess maybe we can start with that because that's usually the first indication that you've got something going on or the first that anybody ever knows that bone density is even a thing. Unless it's been in their family,
Right.
they are oblivious to it.
Right. Or even worse, they present with a fracture.
Yeah. Yeah.
Which is actually the worst case scenario is not knowing that you have an issue and then having a fracture that shouldn't have happened.
Yeah.
So, I
see
guess,
a lot of that.
I wanted to start with, what is bone? I mean, we're talking about bone density, but, first of all, how many of us really think about our bones and the fact that it's a living, tissue? I mean, seriously, we think of bones as kind of like being something really hard and kind of permanent.
Like our hair.
Right?
Our hair's kind of dead, isn't it?
Right. Right. We're watching, like our hair and fingernails, it's kind of like they're kind of, they're grown out, but, they're only alive as they're growing. But, bone, we think of bone as being, like a rock or something.
Like the covering of the bone marrow. It doesn't serve any other purpose than that.
And we think of it as like for support.
Yeah.
So that we can like have something hard that, that we can have a structure like our skeletal system. So our bones act as a holder for things like our brain, which is kind of important, depending on the day, right? Depending on the moment. It's our bones are protective, most of our main organs are underneath a bony covering.
Rib cage.
Yep. We have our rib cage for our heart and lungs and most of our liver, hopefully, and spleen and, things like that. Our pelvic bone kind of protect a little bit, our uterus and ovaries and things like that. And then we have our, long bones, which are in our extremities, which we use for movement, being able to stand, things like that. And so we think of the skeleton as kind of a dead thing, but our skeleton, the tissue in our skeleton is a living organism, right?
Very much so.
Yeah. And so as a living organism, it kind of has the same issues as every other tissue of our body, right? And so what do our cells of our body really need for good health?
Oh my goodness. Nourishment.
Yeah, nourishment. Yeah. Oxygen, a little bit of blood flow.
Yeah.
And with bones, there's basically, there's different types of skeletal bones, but there's also different types of bone. And one of them is going to be, the compact, hard bone. And that's called cortical bone. And then the kind of the lacy, delicate, but still hard, that's called trabecular bone.
Okay.
right? And then
Some
it's
flashbacks to anatomy
I know,
class.
seriously, I had to look up. I'm like,
Woo!
what? I
Yeah.
remember trabecular, but what's the name of that other kind of, what's the hard stuff
know.
called? And then inside of those that bone tissue, then you have your ability, the tissue that makes so many things, like our red blood cells and our platelets and some of our white blood cells are made inside of our bones. And so, then that needs to have blood supply and oxygen and nutrition and oh my gosh, it's really interesting, right?
It really is.
So,
So much.
yeah. And so bone's not dead. It's like a living tissue. And as part of a living tissue, we have like this remodeling,
Yeah.
stuff that
Yeah.
goes on.
Speak about that.
Okay, so remodeling. So bone remodeling is really interesting
It is.
because you can have a dense, dead bone that's not healthy. All right. So there's like this process that's always happening where we have a breaking, we have a dissolving and a breaking down of part of our bone so that we can have building up, it's kind of like a brick wall with like bricks that degrade over time. All right. So if you had a brick wall and the bricks would degrade over time, what you would need to do is you would need to find the bricks that are old and take them out and put healthy bricks
Right.
back in there. And that's basically what our bone is doing. And so we have like cells that are designed to dissolve and take out those bad bones. And then we have and those are called osteoclasts. And then we have other bones that are building, and replacing those bones with new healthy stuff. And those are called osteoblasts.
Okay.
Yeah. Another thing from school,
review.
right?
I know. Review. Things that I should still know, correct?
I don't know
And
that
how-
we learned this in
And
the
how
first
does
place.
that change? Well, and how does that change as we age?
So
Does that continue
man.
to happen?
Yeah, well, it should. It should
efficiently. Or
So yeah, that's a great question because that's where it affects us right now, right? Is how does it affect somebody as they're getting older, and how can we optimize that so that our bones stay healthy for as long as possible? And that's a fantastic question.
Yeah.
Part of it we want to like look at like what was happening when we were 20 years old.
Oh.
Because part of having healthy bones as we get older is having a foundation of healthy bones when we're in our teen years and 20s and 30 years old.
Mhm.
Because what will happen is there's some people that maybe are on medications that decrease their bone density. And specifically a really scary one is Depo-Provera. Right?
Yeah.
Depo-Provera has a fake progesterone molecule, and it's fake progesterone because it keeps people from getting pregnant or being able to carry a pregnancy. And there's a black box warning on the Depo-Provera label that says it like decreases bone density, and it shouldn't be used for more than a couple of years. And it's especially used in people who are who is it?
Mostly just young people use it temporarily. I mean,
Well,
I don't
a lot
know.
of people will use it for a really long time. And what group of people are not given birth control pills? Who doesn't get birth control pills if they're 35 or older?
Hypertensive.
Smokers.
Oh yeah, smokers.
Smokers.
Yeah.
Smokers.
But I guess, and my question is, do other birth control methods affect, like your oral contraceptives? Are they the same?
They're probably not the same because they have estrogens,
Okay.
which are going to
Okay.
increase bone density.
Okay.
And they do have fake progestins, which are going to decrease bone density. So, but on average, they're going to probably average out.
Okay.
But you're putting, people who smoke that want to have kind of reversible birth control might end up on Depo-Provera for how long?
Mm-hmm.
And so then,
Yeah.
like way longer than 2 years for sure. And so then you have somebody who is a smoker who's decreasing their bone density, and they're being put on Depo-Provera, which further decreases their
Explain
bone density.
why smoking thins your bones.
Smoking is gonna
Simply.
well
Of all
the things,
many things.
many things, but one thing is you're just not going to have the oxygen carrying capacity if you smoke. If you smoke, you're probably going to metabolize estrogen faster, so you're probably going to have lower estrogen levels, which is going to impact your bone density, and it's just it's bad.
We could do a whole talk on smoking.
Oh my goodness, we could
but anyway.
But anyway, so. So having healthy bones when you're young is going to help carry you into middle age and older age with healthier bones.
I keep interrupting, but so I know people who were active in their youth, in high school, in their 20s, but now suddenly are osteopenic. What's going on with them? Should I have asked you these questions before?
I should have like a list.
Or should you say?
I should have a list.
Kelly, I don't know these people personally.
How
can I answer that?
I should have a list of approved questions before we get together. Well, number one, we don't know that it was sudden.
Yeah,
okay?
That's true. That's a good point.
Because we didn't look.
That is a good point.
You're not looking.
Because we don't really start testing until what?
Depending on the person, I mean, it might be 65 before somebody gets a bone density.
Depending on family history and such.
Right, and depending on their medications, their history,
history.
their family history, all of those things. You might not look for bone density until they're 65, or you might not look for bone density until they have a fracture.
Yeah, like you said, that comes up, and then they go, okay, we need to take a look.
Right, and so then there was 20, 30 years where somebody maybe was an athlete in high school, which can be very protective unless they're a female athlete and they work out so much that they have a low body mass.
They can go the other way.
So they can stop ovulating and stop making estrogen and progesterone and have low bone density because they're not ovulating.
That's a good point.
So everybody needs to be looked at like an individual, or if they had an eating disorder as a teen, into their 20s and 30s, or if they're a ballet dancer and they have low hormone levels, and and then
a good example.
Right. Yeah. Right. That's somebody that I actually saw in the office as a teenager. There was a teenager who came in that wasn't having periods because she was, had a very low body fat percentage and had low hormone levels because of that. And if that continued for, a long period of time, that would be a risk factor.
Okay. So, interesting.
Yeah.
There's so many factors that come into play.
So many factors.
Yeah.
And that's not counting. I realized that, I didn't talk about medications that decrease bone density. I forgot to even include that when I was doing notes for this. So anyway, I wish nobody's making comments, so I don't know who's out there.
Oh, I see Debbie's on.
Debbie
can hear us and she sees us. Yay. Hi, Debbie.
So anyway, I think we might do Facebook Live again next time because there's so many more comments with Facebook Live.
Funny. Oh, now I can see it here though too. So.
All right.
Yeah. Anyway.
So anyway, there's always this process that's happening between the bones being resorbed and the bones being rebuilt. So there's a remodeling process, and what can happen as we get older is that the rebuilding process is slower than the gobbling up of the bone. And so when there's a mismatch between the amount of bone that's, being put down and the amount that's getting, basically dissolved, then that's when we lose bone density.
Okay.
Okay. So
makes sense.
Yeah. So anyway, there are medications that are used to increase bone density.
Yeah, and I know a lot of people are curious about that. Very curious about that. Lots of questions about what medication, if any, is recommended, side effects.
Right. And we're not going to have time. I made some notes yesterday and, just kind of do a really broad overview because, people do have questions about what's in there. And my, what I want to do is I want to look at the things that are 100% safe to help people rebuild their bones. Okay. We'll talk about this for just a second. But
Okay.
then I want to get into, talk about things that are 100% safe that I think are going to be way more effective and stuff too. And so, like we're talking about, we're either building bone or we're breaking down bone, right? And so the medications that are available, the first medications I think that were kind of developed for bone density were things that decrease the bones from getting broken down. Okay. And so the things in that category are going to be, I think the first one that I can think of is like Fosamax.
Mhm.
All right. So
Yeah.
that was, I think, the
That's-
first prescription medication
Mhm.
that was
It's been
specifically
around a while.
right to treat osteoporosis, and it's been around for a while.
Mhm.
And it's in a category called bisphosphonates, and so that's Fosamax, also called alendronate, Actonel, Boniva, Reclast, which is going to be the IV that people get once a year.
Yeah.
Okay, so all of those are going to work by decreasing the cells that are gobbling up the bone.
Okay.
And then another one, Prolia, is also supposed to work by decreasing the cells that gobble the bone. Is that a good thing?
I'm guessing no.
I'm not sure that that's really the best way to. I'm not
The
sure
best solution.
that that's the best solution. I don't know that that's the best solution.
Yeah.
Because in my mind, what happens if you're taking away a natural process that's used to get rid of unhealthy bone is that you're left with a dense, brittle, unhealthy bone. That might look great. Your bone density is definitely going to be more, but it's going to look great when you're doing a bone density check. But is it a healthier bone? If you're going to look at it under a microscope, would you have healthy cells that have the ability to remodel? And then where would the osteoblasts put new bone if there hasn't been a space cleared for that new bone?
That's a good question.
So some of the side effects of those medications, like the bisphosphonates, like Fosamax, Actonel, Boniva, they can have GI side effects. They can have nausea, heartburn. If a pill gets stuck, it can burn through your esophagus. Yikes.
Yeah.
Heartburn, stomach aches, and these are the ones that make me think that you're not really building healthy bone. Is you can still get hip fractures if you've been on these medications for a while.
That was going to be my question. How often do we see that?
And probably, we hear stories of, ladies who are like waiting, standing and waiting for something that fall because their hips broke.
Yeah, all the time.
Yeah.
All the time.
Right. And they were on medication and maybe their bone density was okay, but maybe they had a brittle, unhealthy bone because they weren't looking at the whole process. Because it's a living tissue, right? And another one that dentists see, and I'm not a dentist, so I don't know how often this happens, but I think it's quite a lot, is that they'll have bad dental outcomes because they have necrosis of their jaw.
Yeah.
So they get actual death of that bone cell in their jaw.
So if they were to start one of these meds, talk to your dentist first. I mean,
Oh,
if it's something
definitely.
that their
Definitely.
doctor felt like they really need to have.
Right,
Yeah.
right. I think you'd have to like have your doctor really show you the evidence that it's right for you,
Mhm.
right?
Mhm.
It would
And
not be
everybody's
right.
individual, so it's hard to
Yeah,
know, but
Yeah.
it does have side effects.
Yeah. And I want to, look at the alternatives before I did that.
Yeah.
Right. So other things that are supposed to decrease resorption, one of them is estrogen. So there are, hormone replacement is the estrogen part of hormone replacement probably works by decreasing the activity of the cells that are gobbling bone. Okay.
Yeah.
But you don't get the brittle bones with that because it's more of a natural process. And calcitonin, which is something that I forgot to look this up if it's actually helping absorb calcium or how that works. So I apologize, I don't remember.
That's okay. I'm sure everybody's like, their mind is probably blown out ready.
Great.
You go into such great detail, and we appreciate that. But
Oh.
some days I'm just like, wow, you know so much. I've forgotten more than I learned. Thank you for remembering.
I don't know. It's like I learned this stuff like 20, 30 years ago, and it's like, I don't know. I have to like review the words because I don't remember the vocabulary sometimes.
It's the worst.
Yeah.
And you get used to speaking in lay terms, so you
Right.
I don't remember the actual name for that. But
I know exactly.
Anyway.
Exactly. So the next class of medications are definitely going to increase bone formation, right?
Yeah.
And so, one I have never used, but it's called Evenity.
I have never
Have you
heard of that one.
Okay,
I
so
have not.
it is a monoclonal antibody that blocks something called sclerostin. I have no idea, how that's supposed to work, but it's supposed to help build more bone.
Okay.
It's given it's a shot. Okay. There's one called Forteo. You probably heard of that. And it's a parathyroid hormone agonist that's given as a shot every day for a couple of years, and then you change medicines for that. There's, once again, calcitonin. I think that one's in both categories. It's a nasal spray or shot, and it's only in women who are only in women, number one, or who have been past menopause for 5 years or more.
Okay.
And it is only effective for spine compression fractures.
Interesting.
So it's not going to help your long bones.
Debbie has a question for us.
Oh, right. Okay.
To what extent is bone loss reversible? And in your opinion, how impactful are
Oh.
calcium supplements? Oh, we're getting to that, aren't we?
Yeah, we'll
To
get.
help prevent or slow bone loss.
Okay. So I just did a thing on vitamin D and vitamin K.
Yes.
That you will need to review to understand. We will not have time to get into all of that today because I just did an hour on that, a week ago.
Yeah.
And so
definitely look at that one, Debbie.
Yeah, that one will answer most of your questions. And I will get back to calcium because we were going there anyway.
Mm-hmm.
All right. Calcitonin, one of the risk factors really briefly that I found is there might be an increased risk of some cancers with that. I did not explore that very much and I don't remember it. So, and then there are some, estrogen replacement therapy itself that we know from like the Women's Health Initiative that was using Premarin and estrogen itself did increase bone density over time, and probably from not gobbling it up. And then there are things called selective estrogen receptor something, SERMs, and those are things like Evista and other things that a lot of times are used to decrease breast cancer risk. So they're like modified estrogen molecules. So those can also improve bone density. All right.
Okay.
So that's what I kind of, a brief review about medications.
Very good.
So what do you, in the office, since you're still in the office, would you have like a guess on like what percentage of postmenopausal women are on some sort of bone density med?
We do a lot of Prolia.
Really?
A
Okay.
lot of Prolia.
Okay. Interesting.
We see a lot of that.
Okay. All right.
Yeah.
And are you guys administering the shots in the office then?
Yeah.
You're doing it? Okay.
Yeah.
And have you seen any side effects from that with women?
Not too bad. Not so much.
Awesome.
Yeah, they're doing okay.
Okay.
Yeah.
Well, good. I think that I don't know as much about Prolia, but I think I would feel probably better than some of the older, like the bisphosphonates.
Yeah.
Probably feel a little bit better about that.
And I know that they do talk to their dentist before
Okay.
they make sure
Okay.
it's okay.
Right,
Especially if they're
perfect.
going to have any dental work or have had a lot of dental work. Very
Mhm.
definitely.
And then
So-
do you see people like after they've been on something like this coming back in with dental issues? Not very
That I
often.
really cannot recall, thankfully.
Okay.
Not off the top of my head, no. So
Good.
that's good.
That is good.
Yeah.
That's good.
Maybe one incident years ago, but I don't know details.
Right. Once
So,
again, we're not
yeah.
in the dentist's office, so
Yeah.
we're not seeing,
Yeah.
seeing issues when they come in.
Exactly. So I don't know if that was something that could have, that
Yeah.
person didn't discuss with the dentist or what happened.
So, right.
Yeah.
Right. Or if it was just truly a side effect, or
Yeah.
if there were other issues going on, like
Exactly.
poor blood flow from smoking once
Mhm.
again,
May
or
have
something like
been.
that, So
Yeah.
more poor tissue healing from,
Yeah.
other things. So,
Exactly.
all right. So Debbie, your other question is, to what extent is bone loss reversible? That is a great question.
That is.
I think that everything is reversible to some point. If you're still alive and you have the ability to improve the situation, that your cells are experiencing, I think there's always the ability to recover, right? And
That's a good point. Very good point. Yeah.
So
Yeah.
if we're alive and we have blood flow and we have nutrition and hormone balance and supplements that people need, then I think people can have reversal of some of their bone loss.
Mhm.
I think it's obviously you're going to be able to have more reversal the earlier in the process that you hit things, right?
Very definitely.
So it's better to start working on this when you're 50 years old or wherever you are right now, or 60.
Yeah.
than
It's
it
never
is-
too late to start, but yeah,
Right.
it's going to be easier.
Right. You're going to have more healthy cells that are available to recruit to do what they're supposed to be doing at 50 than at 80.
Yeah.
But I think if you're still alive at 80, there definitely there's a chance.
There's a chance.
Yes, I've seen there's a chance. I have a friend whose mom whose mom is really into like alternative medicine stuff, and found out that she had low bone density and took just boron supplements, which is a mineral. And I'm not recommending this. All right. I'm not saying to do this, but I think that was really the only thing she did was add a tiny little bit of boron in her water, and it reversed her. I mean, she had a significant increase in her bone density in a couple of years. One thing in a woman who's probably in her 70s. One thing, So, but like I'm saying, I don't know. I would be very cautious because boron could be toxic if you get too much, right? We use it to kill, it's the thing that's in boric acid that we use to kill funguses and, ants. So I wouldn't use very much of it. I'm just saying that
Interesting.
that she had a big increase in her bone
Yeah.
density was
Okay.
something kind of weird like that.
Okay.
So Kelly, I think I should ask you, what do you think would be like the single most?
Are you perhaps, go ahead, throwing me under the bus?
No, I'm
Because
gonna.
I see your next question. I know what you're going to ask me.
No,
Don't go to coffee with Val and tell her that you haven't maybe been using your progesterone.
Oh no,
Oh, that's not what this is going to be?
no.
I figured she was
I'm
totally
gonna-
setting me up.
I'm gonna skip all the way to the bottom.
Oh, you're going to skip that?
I'm gonna skip to the bottom.
I thought it was going to be the sacrificial lamb.
No, I'm gonna give you an opportunity to shine.
Oh, you will.
I was.
Okay.
I'll hit you later with the other stuff.
I knew I wasn't off the hook.
What is probably, you're the expert in this, what is probably one of the most important things that anybody at any age can do for their bone density?
Get walking. Get out and start walking. You got to move for
Yeah.
bone strength.
Yeah.
Absolutely.
Yeah.
And it's so easy. It's easy to get out and walk. It really is.
Yeah, you don't need any equipment except maybe shoes and pants or shorts or whatever.
Yeah, you might want to
Maybe.
be dressed.
Yeah. You want to have
Yeah.
appropriate,
Yeah,
clothing.
Yeah.
But like,
Go out your front door and go for a walk.
right. Because weight bearing exercise is probably,
Yeah.
one of the most important things that you can do from a lifestyle perspective to keep your bones healthy. And, weight bearing exercise is probably better than swimming. Swimming is
Yeah.
fantastic for cardiovascular fitness and muscle strength and all those other things. Swimming is fantastic, but there's something about the pounding motion of walking, running, or things like that, that is really
I think
helpful.
I asked you one time about yoga. And you decided that probably, yes, it was beneficial, but not as much as,
I think
like
that-
you said, that
Right.
actual.
There's an actual thing with pounding, with the pounding sensation that is helpful for bone
coming in
density.
contact with
Coming in contact
Uh-huh.
and having,
That impact
The
of
impact.
your bones.
impact
with
is
the
a great
pavement or
word.
whatever.
There was an interesting study that I read, like, once again 20 or 30 years ago, so I don't remember the details, but it was basically looking at tennis players. And tennis players would have, had a higher bone density in their dominant arm than they did in their non-dominant arm.
Oh, interesting.
Right? Because they're,
Yeah.
number one, they're using it and their muscles are going to be stronger.
And that's
But
an impact. With,
yeah, exactly. There's an impact every
Okay.
time. And it's a tiny little impact, but every time they hit the ball, there's going to be a little bit of an impact
Wow.
that increase their bone
That's
density over there.
interesting.
It's crazy. All right.
Yeah.
So you can play tennis if you want to have a really strong dominant.
Pickleball. Woo!
Pickleball.
That's still on my bucket list. I've got to get that.
So
Gotta get that.
exactly. So if you want pickleball, you're going to help your dominant arm. You're going to have pounding, so it's going to help your legs, the bone density in your legs, and your axial skeleton, which is like your spine.
Ooh, yeah.
So all of
Yeah.
that is going to be, with like walking or
Wow.
tennis, pickleball, any sport where you're like, using your legs and stuff. Okay. So then, let's talk about like supplements. We'll get back to Deb's question about supplements and,
Mhm.
calcium is really super important for bone density, but probably magnesium is really important for it. Like I mentioned, boron, just a trace amount of boron.
And is that something, all of these things can probably found in a really good multivitamin, correct? Or no? I know you probably, excuse me, don't want to recommend, but
I think that
what are your thoughts?
I think that I haven't found a perfect multivitamin yet.
Yeah.
Because you're probably not going to get enough. You won't get enough magnesium, most likely in a multivitamin. You're probably not going to get enough calcium in a multivitamin. I think there's a lot of debate about how much calcium, if we're getting enough calcium in our diet, if we need to supplement, all of those things. And, enough vitamin C, are we getting enough vitamin C in our multivitamin? And I think if we had a multivitamin that had everything that we really needed, it would be about this big,
I That's what
And
I'm
we
sitting here
wouldn't-
thinking. Okay, so how many vitamins do I have to take every
No,
morning?
it would really, it'd be probably the size of a hockey puck, basically. Maybe not, maybe an iPhone, I'm not sure.
Okay.
But I think you wouldn't be able to swallow it. It wouldn't be one pill.
Yeah.
You know, it would be like 12 capsules of stuff, you know.
Yeah.
So you probably can find one that has like lots of trace minerals.
Mhm.
You can take a mineral supplement that, you know, has, you know, 70 different minerals in it.
You know, people are going to be asking exactly how much.
I don't know.
I always get that. They always ask me, okay, but how much? So,
I think if you can find a really good multivitamin that has, or a multi-mineral supplement, that might be a good start. For people that work with me, I use Full Script, which is a vitamin
okay.
clearinghouse for vitamins that are pharmaceutical grade. They're fantastic. So if somebody wanted to set up like a supplement appointment with me that they just wanted to go through their supplements,
That would be
They
a
can
really
use-
good idea.
they could use my scheduling link. Then I could get them on a review their supplements and get them on, you know, really good pharmaceutical grade
Well,
stuff.
and that's just what I was going to say too. Everybody's kind of individual with that too.
Exactly.
Not everybody needs the same
Exactly.
things.
Exactly. Do you live, you know, where do you live? What month is it?
Yeah.
You know?
And for instance, you know, like my family has a history of hemochromatosis, which I don't supposedly have the genetics or the gene for that, but
Okay.
I don't take iron anyway.
Right.
Just because I don't want to take that chance. So I just don't.
So
And
you
the
might
side
actually.
effects of iron are not pleasant
No,
anyway.
they're not.
So
Nobody
I just,
wants to die of iron overload,
well,
right?
yeah.
I mean, it's not a good way.
So
it
I
would not
just-
be fun.
That's just personal for me.
But if you don't carry the gene, you should probably do, you know, you
Mm.
should probably talk to your doctor and at least know what your hemoglobin is.
I
And
know,
maybe do a
and I do.
ferritin and maybe do, you know, an iron level.
I'm okay. I know I'm looking a little pasty today,
See,
but
so anyway.
moving on.
Moving on. Okay, so the next thing is, you know, we do have to have calcium. It does need to be balanced with magnesium. You have to have vitamin D to absorb calcium from your gut anyway. And you have to have vitamin K2 to tell your calcium where to go. So if you're taking calcium supplements, and you're not taking vitamin D, or if you're not getting in the sun enough that you have enough active vitamin D, your calcium is probably not going to be absorbed very well. So it's probably not doing you any good. And then if you're taking it with vitamin D and calcium together, but you don't have vitamin K2, then it could be causing calcium levels to be high in your bloodstream, but then they could potentially be deposited in your arteries and cause hardening of the arteries, or in your joint tissue and cause joint pain, or being excreted in your urine and causing kidney stones. So that was, the other thing that we talked about on Facebook. I think you can find it on my Facebook link.
I think it was because
page.
I believe I shared, I shared it to my group too. It's in my All the Things group.
Okay.
So there too.
Okay. So anyway, review that because that was a whole hour on calcium, vitamin D, and
That's
vitamin
good.
K2. Okay. And then, like vitamin C is really important for bone density because part of the matrix of bone requires, collagen, and vitamin C is really important for collagen. And so then you're talking about
And you just don't think about vitamin C being part of that.
exactly. But what happens if people are really low on vitamin C? They get scurvy, they lose their teeth, their teeth fall out, they have bleeding issues, their arteries break down because they don't have enough vitamin C, and so they don't have strong, healthy collagen, and their skin integrity is going to be damaged, their tendons and joint tissue.
Is that something that is ever even checked?
vitamin C.
Yeah.
I never
hear
ordered
about a
one.
vitamin C level on anybody.
I never
because
ordered
it's
one.
kind of, it's not a thing anymore, right? I mean, it just seems like people
Well, I think people,
get enough of it.
I mean, nobody's a sailor,
That's
right?
what you always, heard
You
of
know?
when they didn't.
right? So people got scurvy
Yeah.
because they were sailing and they didn't have, fruit for months at a time.
So it's kind of amazing when I hear about what people eat that they don't have scurvy because
Exactly.
they don't eat any fresh vegetables or fruits or just any real foods. So it just is fascinating that, I don't know, is there so much supplementation in other foods that's how they're getting
I don't
it?
think so.
I don't know. I guess
don't
that's
think
what I was
so.
curious. I'm just not, where is that coming from?
Right.
How
So
is
where's
that
that
not
coming
happening?
from? So how is it not
Yeah.
happening? That's a really, really good question. And it's not just vitamin C. It's also all of our B vitamins
Yeah.
and one B vitamin called thiamine, which is B1. And there's a great website, Facebook page and website called Hormones Matter.
Oh.
And ironically, most of the
Yeah.
stuff they're not talking about hormones very often.
Oh.
They do once, probably about less than half of their stuff is actually hormones. But what they do is the founder of that page is an expert on thiamine, mitochondrial health, and energy metabolism. And potentially and there's another doctor that was a pediatrician who's now retired, and together they wrote a book on thiamine.
Oh my gosh. Okay.
And I'd love to get it.
Yeah, I'm
someday
sure.
I'll read the thiamine book, but it's probably 400 pages or 600 pages
Wow, that'll be just
on thiamine.
yeah, an afternoon read for you, I'm sure.
Really,
Yes.
yeah, right. So anyway, I don't have that book yet. So, but
Christmas. Anna, if you're watching.
If you're watching, the thiamine book by Derek Longsdale, I think his name, and Chandler Mars. The thiamine
Derek
book.
Longsdale, okay.
Yeah, pediatrician and a PhD that's expert in thiamine metabolism. But what Dr. Longsdale, I hope I'm remembering that correctly. But anyway, what he saw in his pediatric patients were kids that had like undiagnosable illnesses, undiagnosable things like failure to thrive and like wasting syndromes
Uh-huh.
and the stuff that that are very, very hard to diagnose, and what he did with them is, I'm not sure if he even tested for thiamine or if he just replaced it. I'm
Yeah.
really not sure what he did, but he would replace thiamine in these kids and they would totally recover.
Wow.
And it's like, how many undiagnosable diseases are people seeing in America? And it's not just with kids, it's with teenage girls, teenage boys, people who've had COVID, long COVID, people who are who have things that weren't around 20 years ago, that we did not see 20 and 30 years ago. It was very rare to see these undiagnosable things like POTS syndrome and autonomic syndromes and like weird stuff. And we have food that is very calorie dense, but it's not nutrient dense. And so like the junk food,
Sodas.
Exactly.
We didn't talk about diet soda or just soda in
Or caffeine.
Yeah.
For losing bone density.
Yeah. All of that too.
Right? Or Mountain Dew that has brominated vegetable oil. So we could talk forever. There's so many like rabbit trails that you could go off of.
Mm-hmm.
But basically, having having nutrient dense food, because the calorie dense food, it requires extra vitamins to create energy. And so then what happens is you're not replacing those vitamins. And so these vitamins are cofactors in chemical reactions in all of our cells.
Yeah.
So if you have calories coming in, but you don't have the vitamins available to create energy in our cells of our body, in the mitochondria, the energy production plants in our body, then we can't regrow cells, because cells, dividing
If
cells.
I'd only known how to explain this to my children when they were younger, instead of just eat your vegetables.
I can't get my kids to take vitamin D every day. Come on. I know.
There's a reason. There is a reason to eat healthy. There's so many. Anyway,
so if you look at bone density, you have, we have to look at thiamine. We have to look at everything, really, including vitamin C, and all of it. All of it's important.
It is. It always comes down to that, doesn't it?
It always
really
comes
does.
down
Everything
to
we talk about, we always end up talking about nutrition. So I'm sure people get tired of that part of it, but it's just so important.
It is so important. And I think that, if you had to make a blanket statement, if the worse your diet is, probably the more vitamins you need to make up for that. And unfortunately, like we kind of decided before, there's no perfect vitamin. So it's better to get nutrition from food, but there might be gaps in the nutrition that you're getting from your food. And if you are not doing a good job eating healthy food, then you probably have to supplement.
Yeah.
Right? All right.
Absolutely.
So, all right.
Where are we at?
So we have 12 minutes left.
Okay.
And Kelli, I was not going to throw you under the bus with this.
That's okay. I'm ready and willing. I'm prepared.
So what do you think my favorite thing is when it comes to bone density?
Could it possibly be hormone replacement therapy?
Right. So I think my favorite thing when it comes to bone density is hormone replacement. And it's my favorite thing with not only bone density, but also brain health and sleep, urinary tract system, joints, muscles.
Yeah.
Name something.
I know.
Heart,
all the things that you're
cardiovascular.
naming, I'm having issue with. So
Not for long.
brain fog. And
Brain fog,
that's my fault.
exactly.
It's my fault.
Exactly. So how do hormones affect your bone density?
I don't know, because I haven't been taking my hormones, so I'm too foggy to know. I can't remember. I just
You stop your hormones, you lose your brain, and your bones fall to dust.
In a nutshell.
All right. So
Podcast done.
all right. So I wasn't going to throw you under the bus, but maybe I'm going to change my mind.
It's fine.
So, all right, all of our hormones affect our bone density. All right,
Yeah.
Hormones are chemical messengers. They tell cells, they turn cells on. They turn processes in cells on. They turn processes off. They tell cells to divide. They tell them to stop dividing. So hormones are really super important. For me, the hormones that are important to me are going to be your sex hormones and your cortisol, and kind of thyroid, but mostly sex hormones and cortisol. And all of those are really important for our bone density.
Okay.
Like we've kind of talked about estrogen. Estrogen probably decreases the extra gobbling up of bone. But whereas medications might cause permanent decrease in those bones, estrogen is going to cause reversible changes, decrease in the bones that gobble up, or in the cells that gobble up your bone. Okay. So you're not going to kill those cells by using medication. Okay. With estrogen, you're going to slow them down so that it's, that it's going to communicate with the other cells. Okay. Progesterone. My favorite hormone of all is progesterone, because it's the underdog. It truly is the underdog of hormones. Yeah. Right. If most doctors don't know the difference between progesterone and medroxyprogesterone, which is Provera, which is the thing that
Yeah.
causes you to have like low bone density.
Yeah.
And a lot of doctors do not, I think they don't even understand that they're different. Okay. Even
I'm
though,
just cringing because I know so many people who have been on Depo-Provera for a long time.
you know,
And it just, ugh.
I know, and especially so that you're taking, a lot of those people are the ones that are high risk anyway because of their smoking history. And, you know, you don't feel comfortable using a birth control pill
Yeah.
because of the increased clotting risk, you know, heart attacks and blood
Yeah.
clots and stuff with combination oral estrogen. So that
It's a tough one.
it really is.
It
So
is.
they, you know, a lot of women, especially maybe 20 years ago when people didn't really know better, you know, were
Yeah.
on Depo-Provera
Yeah.
or mini pill for a long period of time. And, you know, they really need to do everything they can to keep their bones healthy at this point. But anyway, natural progesterone helps build new, strong, healthy bone. All right. The same thing with testosterone. Testosterone helps lay down new, strong, healthy bone. All right.
Okay.
Now, testosterone needs to be, you know, really carefully used. All right. I don't like pellets, you know, where
Yeah.
people are going to like pellet clinics and getting testosterone injected.
Mm-hmm. I know you've mentioned that before. Yeah.
I don't like that because number one, and then some people are using injectable testosterone. They're giving themselves injections of testosterone, and a lot of times those doses are just too much. More is
For
not.
men too? I mean, is it
No,
different
for
with men?
women. For
okay.
women. I'm talking about
'Cause I know.
for women
Okay.
because men might need injectable testosterone because their dosages are a lot more than ours.
Okay.
So they may need injectable testosterone. But the vast majority of women don't even need testosterone because they can make their own if they have the
Okay.
right supplements. You know,
They make enough on their own.
they can't.
Okay.
Most women, you know, that I've seen, you know, in person, you know, can make their own testosterone if they have what they need. All right. And yeah, so anyway, a little bit of testosterone is great, but a lot is not good. Same thing with progesterone. You know, we want to use a physiologic dose of progesterone. And we want to use progesterone and estrogen together. You know, for people who are still making estrogen, they don't need more estrogen. They need progesterone to balance the estrogen that they have, right? So anyway, all of these things improve our bone density. Estrogen keeps it from you know, being gobbled up. Progesterone and testosterone help build strong, healthy bone. Cortisol, cortisol, I believe, is going to decrease your bone density. All right, because we know that if somebody's on prednisone, you know, or if they're on a steroid for a long period of time, right?
Right.
We
So
know we know that their
Yeah.
bone density is just going to not be great. Has anybody ever looked to see if the cortisol that we produce decreases bone density? I doubt it. I don't know that anybody's actually looked at that, but I believe that if you are under chronic stress for a long period of time, that increases your cortisol production, you know, from your adrenal glands. I don't see how that wouldn't, you know, decrease your bone density, right? So then we want to work at stress reduction and keeping our cortisol levels normal, right? And then another thing that I wanted to just briefly talk about is thyroid replacement.
Oh yeah.
Okay. What is thyroid? If you have either natural hyperthyroidism, so that means your body is making too much thyroid hormone, or if you're using too much thyroid hormone from the outside, that causes bone loss also. And there are, you know,
that's a good one to mention.
It is because I see a lot of weird crap on Facebook pages. All right. And I know there's a lot of weird crap going on in like the alternative medicine, functional medicine arena. And I see that there's a lot of people who are over-treating their thyroid, and getting so much thyroid hormone from the outside that their TSH is being dropped. And that's a sign that your brain thinks that you're getting too much thyroid hormone, right? And so a lot of people are using advanced thyroid testing, and
Right.
even though
It's kind
they're
of a trend. these
Exactly.
days. Yeah.
and even though their TSH is normal, within normal range, they're looking at weird things like well, not weird things, but they're looking at like T3, which is your active thyroid hormone. And if that's a little bit low, then they're using thyroid replacement. They're replacing with like T3. And what happens is their TSH is coming below normal. So that's a sign that their brain is saying, we're getting way too much thyroid hormone. We don't need this much coming in. And that can cause bone loss. All right. Overtreating the thyroid can cause bone loss, and it can crash your adrenal glands long term.
Ooh.
And it can leave you with, like fibromyalgia and chronic fatigue thing. And it can like be worse than not using that at all. So just like a word of warning, because, I see that and it's like, I really don't think this is safe to be doing this. And
Good to know.
yeah. And your thyroid hormone doesn't work well on a cellular level if your estrogen, progesterone, and testosterone and cortisol are abnormal. So those things have to be normalized to let the thyroid hormone work well anyway. So just a warning for people, because you can get like loss of bone density from too much thyroid hormone or uncorrected hyperthyroidism.
Wow.
Yeah.
Good to know.
Yeah.
Good to know.
So, all right.
Lots of information.
Woo!
Wow.
I know. It's like so much stuff. I know that everybody's brain is full at this point, because my brain is like, I'm like, my brain is empty now.
You spewed it all out.
So, anyway,
Oh.
so we didn't have very many questions. I'm not sure how many people are actually watching this.
I'm not either. I'm not for sure, but
And
if
so, yeah.
anybody has a question, yes, let us know. This should be, let's see, it'll be downloaded or uploaded to YouTube, and then
Immediately, I think.
Yeah, it should. So any questions that you might have, you can post them there.
And we will hopefully have a link that we will put in our Facebook group and pages or whatever, and then you can post comments there.
Yeah, that's a good
Um,
idea.
Yeah, and that way I think we'll get a lot more visitors. I don't know if nobody like watches YouTube. I think I'll probably switch back into Facebook Lives instead. And then what I'm trying to work on right now, and I was hoping to have a link available, but it didn't work, is having a private group for people where I do this like once a week or something.
Yeah.
And being able to like go really in depth with a topic with people who are really interested and who really want to learn like primary health stuff.
Yeah.
So I will have more information on that as it gets going. So
Keep us posted.
all right, thanks, Kelly.
Yeah. Awesome. Thanks, everybody. All right.
See you
We'll
guys later. A whole